Thank you for joining me today. This is another segment in our mental health, homelessness, and addictions awareness that we're bringing to the community. Today we're with Lisa Case. Lisa's going to tell me what her position is at the hospital, because I can guarantee you I'll mess it up. Thank you for joining me, Lisa.
Thanks, Dan. I appreciate it. As Dan mentioned, my name is Lisa Case. I'm the Clinical Director for Mental Health and Addictions here at Sault Area Hospital right now. I've been with Sault Area Hospital in the mental health and addictions field for 20 plus years at this point, working directly in the field, in the community, as well as in hospital and some of our outpatient programs. Moved into a leadership role in 2013 and into the clinical director role just in the last year and a half.
And with knowing your position there, you're probably the best person, and everybody said you're the best person in the community to talk to about this issue overall. So what role does SAH have in the overall addictions, mental health, and homelessness situation in Sault Ste. Marie?
Well, I think there's probably a number of people to talk to, but I certainly appreciate you coming to me as well. Sault Area Hospital, we're a partner in providing mental health and addiction services to our community. We offer specifically what's called acute care, so our emergency department, our medical floors, intensive care unit, all for mental health and addictions as well. We have a specialized inpatient mental health unit for both children and adolescents and adults, two separate units. As well, we have an addiction medicine consult team that's available to support care across all of our inpatient areas and the emergency department. And then in an outpatient and community-based mental health services, mental health and addiction services, we have outpatient mental health services, which is psychiatry, social work, nursing support through therapy and nursing. We have addictions counseling as well. We have rapid access addiction medicine. That's a clinic downtown. We have in-home and mobile withdrawal management now. Obviously, I think everyone's aware of our residential withdrawal management. We're also a partner with the Community Wellness Bus, a partner with 137 East Street residents. We are partnered with the Community Walk-In Counseling located at Canadian Mental Health. And we also have an assertive community treatment team for those with severe and persistent mental illness. We work as a partner with several other social service and health organizations, including the Algoma Ontario Health Team, on initiatives like the Wellness Bus, providing direct primary care as well as specialized mental health and addictions care to the community where the community members are. So particularly in some areas where we know there's higher risk for homelessness or being underhoused with mental health and addictions issues as well, and providing non-urgent medical care there too. We specifically engage with our patient and family advisors that we have here at Sault Area Hospital, those with lived experience. They directly provide their input to our staff and our leaders to help improve care. Some of those experiences have led to improvements with, how we handle patient or client belongings in our care, access to things like telephone and internet, being able to access social media while they're in care, working to address stigma both within our patient and client populations, but also with our staff and physicians. And specifically, in regards to withdrawal management, we have a group of patient and family advisors that are helping to co-design that facility, including the furnishings and the fixtures and equipment that we'll use there. We're also working with social services right now to support the underhoused and the homeless, particularly right now in the COVID-19 pandemic, providing infection prevention and control consultation, staffing support, consultation of physical resources as well. Those are some of the things that we're doing to help the situation in Sault Ste. Marie.
So we've seen, or at least I've seen you present to council, a continuum of care. It looked like a triangle to me, so I called it a treatment triangle. The continuum of care, can you explain that a little bit more, like why the be-all end-all of this is not necessarily inpatient residential care and why some of these other things actually help reduce some of these issues?
Yeah, absolutely. And they're essential, that continuum of care, or that triangle. And I appreciate that. It's a triangle with the base being the broadest piece. And that's the piece where most of the general population will fit, those with kind of low intensity needs. Individuals, so we talk about things that we all need: health promotion, general wellness, family support, school-based prevention, those initiatives. And then if we move up that tier, up to the next tier or the next platform there, we think of things like primary care, public health, employment programs. Those with moderate needs need outreach services, and we'll talk about that hopefully in a few minutes. But then we think of like outpatient or community-based interventions. So as I mentioned, outreach services, opioid replacement therapies, alcohol treatment, home-based withdrawal management, which we'd see there as well, or in community withdrawal management. Move up to the next level, you end up with a little bit more specialized care, and fewer people need this type of care. But we'd see outpatient counseling, intensive day treatment, where someone would go for care and attend throughout the day and then stay in their own home or at a friend's place at night. We'd have supportive residential withdrawal management, which is another level of care. That's part of what we offer here in Sault Ste. Marie. And then at the top of that tier, we would see like very specialized services, inpatient services, residential withdrawal management, medically supported withdrawal management. So where we've been able to add in registered nurses, nurse practitioner, physician support and consultation to that service as well. So what we would see is at the bottom, most if not all of us need that low intensity self-care, family support, prevention activities. The service need, their service intensity is quite low. The service volume, the number of people that need that is quite high. As we move to the top of the tier, the service intensity is very high. And the number of individuals that require that level of care is much lower than that base. Hopefully that gives you a better understanding of that triangle. It's something that we adopted from the Addictions and Mental Health Ontario, and I believe they adopted it from the Canadian Centre for Substance Use and Addiction.
So it's well studied and well researched, and you've been seeing some, I'm guessing you have been seeing some success with this, correct?
Yes, yeah, we are starting to see a number of things that are helping to divert people from needing the most intensive care. It does and it will take a while to get that flip to happen, and particularly around prevention and having people avoid having to get into the system for care altogether.
We spoke with Ross Romano last week on the same subject matter, and he was giving me some stuff the province has done to help SAH, but he did say to ask you what other things, is he sure he missed some? What are some of the things that SAH has asked the province for and have been provided to help this situation?
I think certainly the most public one that people are aware of is that we continue to work with the Ministry of Health, Ontario Health North, Minister Romano, to support the relocation of our residential withdrawal management. We moved from Queen Street into Sault Area Hospital as a result of some rising risks in the building that we were in back in March of 2020. We've been housed within Sault Area Hospital, but operating as a residential withdrawal management since then. So continue to work with those folks and the province on securing that site, making good progress, designing the new site and renovation. Services currently offered at Sault Area Hospital, they'll be relocated to that new facility. And in addition to that new facility, we'll expand services to 24 beds in total. That's an increase of 8 beds from what we had downtown. And then plus the newly added in-home and mobile withdrawal management. And I'll speak to that. We've been supported by the Ministry of Health and Minister Romano, Ontario Health North, in some specific investments to expand mental health and addiction services, particularly the addiction medicine consult team, which provides support and consultation to the hospital emergency department and any of the medical units, as well as the inpatient psychiatric units. They provide consultation and support both from a medical and a psychosocial perspective. We've also been able to add the Rapid Access Addiction Medicine Clinic that came on board in 2018 with a financial investment. And then again in 2021, so very early in this year, we received some funding to add additional nurse practitioner resources to that location. We have registered nursing now to support residential withdrawal management and in-home withdrawal management. For many years, many years, we were supported solely by social service workers or addiction service workers in that particular program. It did great work, but being able to really enhance that with the support of our nursing expertise. And now we are currently in the process of recruiting for a nurse practitioner to support that service as well. We've also been able to add what's called enhanced safe beds. So beds for individuals that require a longer stay. So not necessarily more intensive care, but they need a longer stay. They would often come to us with co-occurring mental health, addictions, and some involvement with the justice system as well. We've been able to expand that program with the provincial support. In addition, the Mobile Crisis Rapid Response Team, which started as a pilot, a collaboration with Sault Ste. Marie City Police, specially trained officers with mental health and addictions, nurses and social workers that support that team. Then in addition, a few other supports that I am aware of that we work quite closely with through Canadian Mental Health Association of AGOMA, peer support in our emergency department, those with lived experience that are paid peer workers that provide support to individuals accessing the emergency department that need someone to talk to. They may need support in how to access care, navigating the system, that sort of thing. That particular service has been impacted significantly by the COVID-19 pandemic with trying to keep the traffic in our emergency department lower, but it is available virtually through telephone support right now. And we will most definitely welcome those workers back into our emergency department as soon as we're able. And then in addition, there's been, and I know this one might be hard to swallow right now, but additional mental health justice supportive housing added into the system as well. We still aren't at capacity to support those that need that, but that's through Canadian Mental Health. And we often, our services at the hospital make referrals to that particular service quite often. But those are some of the investments that I'm aware of from the province.
Does the city have a role in working with you guys to address this issue?
Well, I certainly can't speak for the mayor, but I can tell you that we've worked very closely with Mayor Provenzano. He's been, I would say, a tireless advocate for bringing the new facility specifically to our community. We continue to work with him and City Council, our community partners, to try and not only add additional services, but improve the quality of the services that we have in our community.
When I reached out to the community for some questions, and a lot of really weird ones came back, and that wasn't what I expected. One of the ones that did come back a couple of times revolves around Suboxone and methadone. Now, those are two treatment options for individuals that show up with addictions down the road. Is that on the formulary at the hospital?
Yeah, it's a great question. Both are currently on the formulary at the hospitals. Methadone has been on the formulary for many years at this point. Suboxone is a relatively new add, and that has to do with provincial legislation and the special training that was required at one point for to be able to prescribe Suboxone. But both are available. They can be ordered and reordered by what's called the most responsible physician. So the physician who's providing your primary care in hospital and who follows the current legislation. For that physician, if they would like support in both assessing the client or the patient at that point, if they're in hospital, and prescribing, that addiction medicine consult team is available to support them in that. So if we have a physician who hasn't prescribed those medications before, is uncertain, wants to be careful in doing that, that team is available to provide support, not only to the physician, but to the staff and the patient themselves. And then with withdrawal management, an improvement that we've been able to make in the last year, provincial standards would not allow us to store those medications on site. So we did some work with a local pharmacy. We have an agreement that's been developed. Our care team is now able to prescribe those medications, and prescriptions can be delivered to the unit 24 hours a day within the hour. So what our workaround prior to that was that we would get a family member or put somebody in a cab to get to the pharmacy to get their medication.
I'd heard that a couple of times for sure.
Yeah, it was, and not just a challenge here in Sault Ste. Marie, it's a challenge across residential withdrawal management across the province. That's since changed. So we're really happy to be working with the pharmacy we are. Additionally, the provincial standards have changed. So when we move to the new facility, we'll be able to store those medications on site as well. But in addition to those two medications, so those are very helpful medications for individuals that are struggling with opioids. We have a number of clients that use multiple substances. We have other individuals who use alcohol somewhat exclusively. But with the support of the nursing team and physician leadership, we've been able to develop medical directives to support clients through their withdrawal symptoms, including things for sleep, fever, pain, nausea, vomiting, diarrhea, nicotine replacement, the things that historically when we were downtown, and before we had the nurses on board, we would have to send someone up to the emergency department for all of those things. And now we are able to care for them on site within withdrawal management. We'll be able to do that at the new location as well.
And that actually brings me around to my next question. How's the breakdown going to work at the new location? Like, we know we have the 4 beds inside the emergency room right now that are for this, and then we have the residential that's in-house at the moment. Out of all of this, what is moving to the new facility on Old Garden River Road?
Yeah, so the 4 medical beds, or what we'll call medical beds or in-hospital beds, they'll stay here at the hospital, and they're intended really for if not necessarily the emergency department. In the emergency department, you're not actually an inpatient yet. You're not an admitted patient, but we'll certainly care for individuals there. But those 4 beds can float between our intensive care unit, depending on what the person's needs are, our medical units, our inpatient psychiatric unit, our child and youth psychiatric unit, or our pediatric or women and children's health as well. So in that, those 4 beds will stay here. We'll have 20 beds at the new location. That breakdown there will be 10 beds for what we would consider acute withdrawal. So individuals that are either acutely intoxicated or in active and acute withdrawal. They need close observation and support from both the nursing team and the addiction service workers. We'll also have 10, what we would call on paper, post-acute beds. Those would encompass the safe beds as well. So those are individuals that have they're no longer intoxicated. They're through that early and initial withdrawal, but they still need a period of stabilization. Of those 20 beds, each will be in a private room. So we'll have 20 private rooms with 20 private washrooms, and those include two specific rooms that are designated for those that would have alternative care needs. So they need a low sensory room. Maybe they have a high history of trauma. Depending on the substances they've needed, they need a very quiet room, of high intensity for space, safety and space in that. Those particular rooms, we've spent a great deal of time researching and what the furnishings and fixtures will look like in those rooms as well. And then on top of the 24 beds total, so 4 here at the hospital, 20 in the community at the new location, we're also now able to offer outpatient and community-based withdrawal management. So both within rapid access addiction medicine, so being able to access that clinic with the appropriate resources, one could avoid withdrawal altogether and get that support from both medication and counseling support. And then in-home mobile withdrawal management. So we have a very small team that is able to provide that support for individuals that would have like low to moderate withdrawal symptoms, but they have a safe place to stay. So they can get that monitoring and support, the medication, and the counseling, but say either in the comfort of their own home, perhaps in shelter at a friend or family member's house as well. So
we look at that. So once they've reached the top of that continuum of care, walking them back down to the bottom is kind of possible too, when you're talking about the RAM clinic and this in-home stuff, correct? Right?
Yes, that's correct. Yeah.
Okay. So only a few more minutes left here with you. How does SAH envision the new treatment center helping the community? Is like, we know we're going to be able to keep methadone and Suboxone on site. How else is it going to help the community with the ongoing issues?
I think, particularly about increasing capacity. So we know that this particular service will fall kind of at the higher end of that continuum. So near the top of the triangle, including those medical beds would be at the very top. So increasing capacity where we were for 40 plus years downtown, providing, the best service we could under the conditions that we had. I think we'll see that we're finally able to offer that top tier service here in Sault Ste. Marie consistently. And then it allows us to continue to build. So beyond the new facility, but being able to, the investments that have been made with those other services, and as they grow, so some of them are in their infancy yet, we continue to work with, as I said, by our patient and family advisors, our community partners to streamline those, to work together so that we can get more mileage out of them. But I think it's a key piece so that those that need that most intensive care can get that here in Sault Ste. Marie. So we talk about timely care, accessible care, close to home, that's really tailored to the individual needs. And I know I mentioned it earlier, but being able to co-design that with with those that have used the space, that are familiar with the needs of those individuals, has been essential and invaluable.
And if you had the ability to say, I want one thing past the treatment center and anything else to bring to the community to help the overall situation, what would it be from your opinion?
I think if I had, I'm going to go with two maybe. If I had one that I could ask each and every individual that is able to, is to, take a mental health first aid course, and in doing that, get some naloxone training through any of the local pharmacies and carry a naloxone kit, save a life. And then if I were to ask perhaps those community members, the municipality, our community partners, I would say harm reduction, early intervention, and prevention. So we need to keep pushing together collectively, make the most of what we have, and to continue to create, healthy, safe, affordable places for people to spend time, to gather, particularly our children and youth. We need safer places for them to do that.
And we asked Ross this question. I'm going to ask you this question too. I know there are parents out there that have maybe lost children, or there are people out there that are struggling with addictions right now that are probably watching this. What would your message be to them?
To hang in there as best they can. One piece that we are doing that I'm pretty excited about, it feels like it's taking way too long, but we just started on this journey. We've started on a partnership with a group that's affiliated with the Canadian Centre for Substance Use and Addiction. So they're a national group, and our local partners are working to create a document based on, there's a template called Parents Like Us. So I would say Google Parents Like Us. It's out of Victoria, BC. But we're looking to develop a document here with that same level of best practice guidelines, the things that we know that work, but then develop local content. And we'll need all of our community partners' help to do that, but helping them with the informal support and navigating the system, because we know just even what we talked about today, there's lots of moving parts. It's a complicated system. We want to work towards one door, but I would say hang in there and check out that resource and watch for the upcoming resource that we're going to develop together.
Thank you for joining me today, Lisa. This has been very informative.